All right, welcome to Brain Health with Dr. Nissen. In this show, you'll learn about how what we eat affects how much inflammation we have in our body. You'll learn about how diseases like depression and Alzheimer's are related to inflammation. You'll learn about the importance of animal foods and how they allowed our brain to grow and are required for optimal brain health. And you'll also learn about whether or not red meat is bad for our blood vessels and bad for the environment. So hello, Brain Health community. I am here with Dr. Saladino. Dr. Saladino, would you go ahead and introduce yourself for those who are not familiar with you and your work?
Yeah, I mean, you can just call me Paul. I don't like the formalities. My dad is Dr. Saladino too, so I'm a formally trained medical doctor. I'm an MD. I went to medical school at the University of Arizona, did residency at the University of Washington. Before I went to medical school, I was a physician assistant in cardiology. But it was during those 4 years of being a physician assistant in cardiology that I really became pretty disillusioned with the mainstream medical model and found it to be pretty symptom focused and pharmaceutical based, and decided to go back to medical school to try and create some ability for myself to practice in a more, quote, holistic way, at least a root cause driven way intellectually. So that's been my path. During residency and medical school, I experienced a lot of my own personal issues, autoimmune and otherwise, and went down some very interesting dietary rabbit holes, kind of connecting the dots for myself. And that's where we are today.
Awesome. Well, for the few other things that Paul didn't mention there, he's been very busy, been very productive. He is he's well known for his work with the carnivore diet. He's the host of the popular Fundamental Health podcast and the author of the best-selling book, The Carnivore Code. Dr. Saladino is board certified as a physician and nutrition specialist and in psychiatry, where he completed his residency at the University of Washington. Today, I have the opportunity to speak with Dr. Saladino, or Paul, about this relationship between diet and mental illness. And I also want to mention you have the release of the second edition of your popular book, The Carnivore Code, coming out just in a few weeks here on August 4th.
August the 4th, 2020. Yeah, I'm not exactly sure when this podcast will be released, but I bet it'll be right around that time. And August the 4th, the second edition of the book, which you can see there behind me if you're watching on video, will be out. You can go to the Carnivore Code book to pre-order or to grab it. Super exciting stuff.
Awesome. Congratulations. It really looks incredible from the parts that I've read so far. It's huge. So so keep that in mind too. It's something that I'm kind of biting away at little by little. But thank you so much for your work with that. So, so why don't we dive right in? I think that one of the things I really want to focus on with brain health here is about the role of inflammation, which is becoming more and more, well understood as a component of mental illness and of brain disease. So, with this impressive research coming out about neuroinflammation, how are brain diseases and mental illnesses related to inflammation?
Well, what's so interesting is that I did a residency in psychiatry, so did a lot of neurology, and not once in my residency did anyone tell me about neuroinflammation. But I kind of was curious about it, and I stumbled upon it in my residency and did a number of CME presentations, a number of talks about it. That was really the beginning of my interest in this field per se, but there's a lot of connection here. If you look at, I've got some articles I could even pull up for you and show it if I can do a screen share. But if you look at basically any psychiatric disease, any neurologic disease, the majority of the time you're going to see neuroinflammation. And what does that mean? At the broadest level, what we're seeing with neuroinflammation is this changing of the microglial cell phenotype. So microglia are these brain-derived macrophages, and they shift from this, I think the M2 phenotype is kind of turned off at a broad level, the M1 phenotype is turned on. We see that these microglial cells, these brain-derived macrophages, are turned on in diseases like Alzheimer's. Mm. And they're turned on in diseases like bipolar or severe depression or bad anxiety or schizophrenia. So we know there are immune cells in the brain, and they get really, really pissed off and turned on in a lot of these conditions. But nobody's really talking about this. And nobody's also, talking about the fact that a lot of the meds that we might use can treat this sort of inflammation. There are a number of medications that we use that have efficacy that affect this microglial cell phenotype. Now, as I said earlier, what I'm most interested in is the root cause of that. But it does corroborate the hypothesis that this brain-derived inflammation, this neuroinflammation, is driving this process when we can use medications that affect microglial cell phenotypes and see improvements. There's data regarding SSRIs, there's data regarding other medications we use that these can actually affect the way that microglial cells are turned on and off in the brains. Most listeners will know that these medications have some pretty, I would say, significant side effects, and I don't really like using a medication to treat a symptom without correcting the root cause. But as I said, it at least is support for the overlying hypothesis or framework. So I'll just share a couple of basic papers. So this is a meta-analysis of cytokines in major depression. It's from 2010, but really interesting stuff. And you can see here that if they look at 24 studies, these are unstimulated measurements of cytokines meeting DSM criteria for major depression. And you can look here at the results, and they show that there were significantly higher concentrations of TNF alpha with a very significant P, and also IL-6 in those who had DSM criteria for depression. You can see these p-values are less than 0.0001. So pretty freaking significant findings here. And their conclusion, significantly higher concentrations of the pro-inflammatory cytokines TNF alpha and IL-6 in depressed subjects compared with controls. So that's a start. And then you can also find data showing that in people with suicide or suicide completers, you find higher levels of similar cytokines. So for instance, IL-6 elevated in the CSF of suicide attempters and related to symptom severity. So this is quite interesting as well. So significantly higher in suicide attempters rather than healthy controls. Patients who performed violent suicide attempts displayed the highest levels of IL-6. There's a significant positive correlation between the MADRS score and the CSF IL-6 levels in all patients. And as we saw in the last study, IL-6 and TNF alpha significantly correlated with both of those cytokines, significantly correlated with 5-HIAA, which is obviously the precursor for serotonin, homovanillic acid, precursor for dopamine in the CSF. And they proposed a role for CSF IL-6 in the symptomatology, suicidal behavior, possibly through mechanisms involving alterations of dopamine and serotonin metabolism. But, this model hasn't been fully worked out. Could be that. Certainly, I think that the microglial cells are involved here as well. So there's a ton of research down this rabbit hole, but how many of those listening to this in medical school will be told these things or talked about this? It's usually drugs. In most of the psychiatric literature, we are taught this monoamine hypothesis of psychiatric disease, which is really antiquated, and it's basically an anachronism at this time. But we're never told about this neuroinflammation, probably because we don't have drugs to treat it. But we have other interventions that can treat it if we start to trace back our steps and think about where it's coming from. Here's one in bipolar. Inflammation as a neurobiological substrate of cognitive impairment in bipolar disorder, evidence, pathophysiology, treatment implications. So their conclusion, this is a review of 8 studies, including 555 bipolar disorder patients. Several studies suggest that immune dysfunction is associated with cognitive impairment in bipolar disorder. Several neurobiological pathways have been identified whereby immune dysfunction may promote cognitive impairment in bipolar disorder. So this is super interesting to me. And the next question is, where the heck is this coming from? So that is the next part of the rabbit hole. The first part of the rabbit hole is, okay, there is inflammation in psychiatric and neurologic disorders. You can also find this in things like Alzheimer's. Like I said, if you look for Alzheimer's and microglial cell activation, you can find lots of literature on that. But in psychiatric disorders, it's very clearly demonstrated. So where is it coming from? We can go there next, but it totally changes the model when you imagine that there's neuroinflammation. And I would even characterize most neurologic disease, both psychiatric and Alzheimer's, dementia, neurocognitive, as autoimmune, which is a pretty radical statement in most medical circles these days. But we're dealing with the spectrum of autoimmune illness here. We have the body attacking itself. The inflammation is clearly coming from the body. There's not an infection in the brain. that's causing these microglial cells to be activated or these cytokines to be disordered. So where is it coming from in the body? That's where we go next.
Right. So speaking of which, you had said that there's no, current treatments for this, no current medications for this, but there is this inflammation coming from the body. And I think, with how much you talk about diet, I imagine that's what you may want to go into next. But what are the different components of inflammation in the body, and how do they relate to brain inflammation?
Yeah, right. So, I think it depends on what, where the listeners are coming from and what school of thought they're interested in. But there's a lot of interest in this now, systemic inflammation. And what's funny is that I was doing a talk in my residency a number of years ago for a number of attendings and medical students and clinicians, nurses, and it was on this idea of neuroinflammation in depression and psychiatric disease. And I asked them, what is inflammation? I just asked this room full of attendings and residents and medical students, and really most were at a loss because we don't really get taught this in medical school or our training formally. We don't really get taught what is going on here, or what the roots of this inflammation is, or even really how to define it. So I just want to start with an idea, because I think that a lot of people listening to this are medical students, and you're going to hear the word inflammation, and you're going to hear rubor and dolor and tumor, and you're going to think, okay, but what is inflammation? And inflammation is a milieu. It's really a cytokine milieu of these pro-inflammatory cytokines being shared among these immune cells. So we have an inflammatory sort of state. There's an inflammatory zeitgeist in the human body. The mood of the human body is basically like riots. It's just everybody's pissed off. There's these alarm bells going off. The body is reacting to something. Most will know that that is a normal thing to happen many times, but sometimes it is not a good thing to have happen. And that is where we are finding the main issues. So when is it a good thing to have happen? It's a good thing to have happen if you have coronavirus, if you have SARS-CoV-2. It's a good thing to have happen if you have Staph aureus, if you have impetigo in your skin, if you have a parasite in your gut. It's a good thing to have inflammation. If you get a cut on your hand and you want it to heal, it's a good thing to get inflammation. But what is autoimmunity? Autoimmunity is sort of self-directed inflammation and saying, oh, these are these evolutionarily conserved mechanisms for the body to fight invaders and to repair itself that are being activated improperly. Why is that happening? That to me has been the most fascinating question throughout my medical education, thinking, okay, I see these conserved mechanisms, and so many of the diseases that we suffer from today in 2020 as a population are sort of evolutionary environmental mismatch, meaning that we are incorrectly or improperly activating these evolutionarily conserved physiologic processes in the human body because of a discordance between our environment and our genetics. And what I mean by that is there is something in our environment, usually, that is triggering these evolutionarily conserved, in this case, inflammatory mechanisms. In a lot of my stuff recently, I've been talking about evolutionarily conserved mechanisms of insulin resistance, which we can also talk about. And they're all connected in some way. So they're kind of connected in this triangle between oxidative stress, because we know that at the level of the mitochondria, oxidative stress and reactive oxygen species are what signal to the insulin pathway to become shut off or insulin resistant. That insulin receptor is very sensitive to the oxidative status of the cell and tuned into the mitochondria. So that is connected with inflammation, because when there's inflammation, we can get more reactive oxygen species. And we know that in states of inflammation, we can develop insulin resistance. That's a little bit of an aside. In this case, we're thinking just more broadly about what are the environmental genetic mismatches that are causing these evolutionarily conserved mechanisms of inflammation in our body to be activated and to turn on things in the brain, like the microglial cells in this case, or in the case of other autoimmune disease, eczema, psoriasis, lupus, Sjogren's, to turn on that sort of mechanism. I'm going to say something pretty controversial here. Mainstream Western medicine, what you are all taught in medical school, is that these autoimmune diseases are due to a bad poker hand. They are due to a bad poker hand of genetics. That is bullshit, in my opinion. That is pure bullshit. There are a very small number of genetically predetermined diseases. The majority of what we experience as humans in 2020 is environment, it's lifestyle. But Western medicine hasn't woken up to that fact, and they won't wake up to it for a while, when they do wake up to it, they will realize they are completely malleable by shifting our environment. And then environmental piece, the biggest part of that is our food, the things we go in our body and how they create immunologic activation or immunologic quiescence or nourish us or sort of piss us off by creating issues in our gut. Does all that kind of make sense?
Yeah, absolutely. And I'm eager to hear, which foods in particular you think are the biggest culprits for increasing the inflammation in our bodies.
Yeah, absolutely. So I just want to share this one other thing. I found this article while we were talking. This is microglia and inflammation in Alzheimer's disease. If you want to put these links in the show notes, people can check this one out too. So this is another really interesting one, just showing that the microglial cells are activated in Alzheimer's. So back to what I was saying earlier, then the question becomes, what are these environmental inputs that are triggering our immune system? And this is where we get pretty closely into the realm of hypothesis. There's a lot of clinical observation, a lot of N=1, a lot of anecdotes in my own personal practice and other people's practices in the community at large. But I think that for the majority of people, and this is why I wrote the Carnivore Code, and I'm interested in what are called animal-based diets, the majority of the foods that are triggering the immune system are those which are damaging the gut. And for most listening, this will not be a foreign concept. And these are things like, I believe, mostly plant foods that have defense toxins in them, things like phytoalexins. If listeners are familiar with botany, this will not be a foreign concept. If you're not familiar with that, this may sound like lunacy, but it's real botanical science. This is not opinion or conjecture. Plants contain defense chemicals. And many of these defense chemicals are known to us at a greater or lesser extent. We're mostly familiar with gluten and this lectin, this fragment of the gliadin molecule, or gliadin is a fragment of gluten peptide, that can trigger the immune system. Lectins are carbohydrate binding proteins. And these are well known to trigger immunologic reactions in humans. Ricin, which is this huge toxin used in biological warfare, is one of the most potent lectins known to man. Ricin binds one of the ribosomal subunits and completely shuts down protein synthesis. It brings it to a screeching halt, and people that are exposed to too much of it die. So this is not conjecture or opinion or pseudoscience. This is real stuff. There are other lectins, carbohydrate binding proteins in legumes, phytohemagglutinin. There are lectins in peanuts, these seeds of plants, the sort of plant babies, which are seeds, nuts, grains, and legumes, are full of these lectins, these carbohydrate binding molecules that generally do not play well with human biology. Now, to be most accurate in what I am saying, there are lectins, carbohydrate binding proteins, in all of the foods we eat, but some of them play worse with our biology than others. And I believe this is probably because of sort of a phylogenetic distance from what we are eating. Like a plant seed is not something that a human is going to evolutionarily eat because it is highly defended by both these molecules, which look very much different than our biology, and many other plant defense molecules. So there are lectins just as a start, but there are other things like oxalates, a dicarboxylic acid, which is present in much higher amounts in plants than it is in the human body. We make oxalate or oxalic acid as a breakdown product of proline and hydroxyproline in human biochemistry through the glyoxylate pathway. But most people don't make a lot of oxalate. There is a genetic condition called primary hyperoxaluria, which is a polymorphism in one of these enzymes in the glyoxylate pathway, which leads to systemic oxalosis, like you get nephrolithiasis to a massive degree. And most people with primary hyperoxaluria get kidney failure because they have so much oxalate circulating that it deposits in their tissues. But we can essentially mimic levels of oxalate in the human body that one would find in someone with primary hyperoxalosis if we are eating lots of plant foods that are high in oxalates. And many of the plant foods that are very high in oxalates, I talk about all this in the book and I have a chart of them, are some of the foods we have been told are most healthy for humans. Spinach, almonds, beets, kale, rhubarb, turmeric, very high in oxalates. There are documented cases of kidney failure leading to sustained need for dialysis in a patient who did a green smoothie cleanse. Now, granted, this patient had Roux-en-Y gastric bypass, which is going to cause some degree of fat malabsorption and increased absorption of oxalates, but it is well within human physiology to give yourself kidney failure if you have fat malabsorption after a Roux-en-Y gastric bypass by drinking green smoothies, which means we are really not that far from it even when we're not doing that. And there are lots of examples of this. People may be familiar with the most common type of kidney stone, which is calcium oxalate. Well, where does that oxalate come from? Generally, it comes from the foods you eat. And my dad, who's a physician, had a kidney stone. I said, Dad, what were you doing? He said, you know what? This is, again, it's just an anecdote. He said, you know what? I started eating spinach again. I was like, you can't, like, that's not good for you. I don't think spinach is good for humans. It's a leafy green. It's part of the plant that doesn't want to get eaten. I can back all up and explain all this in a moment, but there are myriad toxins within plants that can do this, that can harm our gut, that can create these, this abnormal levels of these chemicals in the human body and lead to problems. And then we go further down the rabbit hole. There are things like saponins, which someone has probably never heard of. Again, these are plant defense molecules. They're a combination of a carbohydrate and a triterpene molecule, like a steroid backbone. They kind of form a soap. They have a hydrophilic and a hydrophobic region. And these are also probably very damaging for humans. And they're used by grains, things like quinoa or spinach, to prevent digestion of those plant foods in animals, because let's face it, plants don't want to get eaten. Neither do animals, but plants can't run away. Animals can kick you or gore you or bite you, but this has been largely forgotten about. And this is why I got interested in this from my own autoimmune illnesses, specifically eczema, and then wrote the book and kind of dove into this rabbit hole around plant foods, that this idea of plant toxins causing issues for humans has been largely ignored, because right now, the overall idea is that plant foods are the best thing on the world and we should stop eating red meat. And I'm thinking, this is going to hurt a lot of people. Not only are we going to become nutrient deficient, we're going to have lots and lots of side effects, sequela down the road related to these plant toxins. So I'll wrap it back up there. I know I'm rambling, but there are many different types of plant toxins that I think can affect humans and begin to initiate this autoimmune reaction. The hypothesis that I think is most compelling is something that begins in the gut, that begins with a sort of molecular mimicry, these pathogen-associated molecular patterns, these damage-associated molecular patterns of molecules like gluten, lectins, oxalates, phytic acid, saponins, other phytoalexins, even polyphenols can do this. And it's triggering a leaky gut phenomenon. It's triggering the release of zonulin. It's triggering these gut permeability factors that are opening these gut tight junctions. And therein, this lamina propria associated immune system comes in contact with the massive amount of flora in the gut, and we get this inappropriate activation of the immune system. Now, the thing that's interesting for me is that every person is going to manifest this differently, and this is the overlay of genetics and environment, that when someone gets their immune system activated, I get eczema and asthma, you might get thyroid disease or rheumatoid arthritis or something else. It depends on where the susceptibility is in your genetics. But in general, I think this is a very interesting idea that should not be ignored, that these plant foods, number one, do not want to get eaten. They are full of defense chemicals, and every individual human is going to have a variable ability to detoxify them. And every individual human is going to have variable sensitivities. My hope with carnivore diet and the animal-based diet movement or ideas is not to convince everyone to stop eating plants. It's to help them understand two things. Number one, which we can get into next if you want, that red meat is not bad for humans and has been incorrectly vilified repeatedly in the last 70 years by shoddy science and horrible epidemiology done by the likes of Ansel Keys and et cetera, on and on forever ad nauseum. And red meat is full of incredible amounts of vital nutrients for humans that are not represented in the plant kingdom. Number two, that plants exist on a spectrum of toxicity and can harm certain individuals. If we are not thriving, we should eliminate them from our diet, or partially or in their entirety, and then reintroduce gradually. But there are plant toxins, and I think it all comes down to this disruption of gut membrane integrity, and that can happen due to a variety of toxins.
I want to thank you so much for your time. I'm encouraging everyone to go out there and read your book, and I'll look forward to finishing it here in these next couple of days. Thank you very much.
Yeah, it's my pleasure. You can find it at thecarnivorecodebook.com, or like you said, you can find all my stuff at carnivoremd.com.